I think the only caveat that I would add to all of this is that I am learning about this myself too. And, the things that I've said are just reflect where I am in my own education right now. One of the most dangerous things you can do is speak up before you've learned it all. And it's so, this just reflects what I know now and where I am in my own self-education.
Would you mind telling us a bit about yourself?
Sure. I'm Catherine Kolkmeyer, and I'm the executive director of the La Crosse Medical Health Science Consortium, and also a biology student. So I majored in biology in college back in 1989. So good to be among my people here. Let me tell you a little bit about the consortium. So the Health Science Consortium started in 1994. And the reason we came together, it's a partnership of institutions in the community, including Viterbo, in higher education, K-12 education, public health, and healthcare. So it's both medical systems, Gundersen and Mayo, the public health department at the county, Viterbo, Western, and UW-La Crosse, and who am I missing? The La Crosse School District. And so the leaders of all of those organizations make up our board.
So, how would you personally define a health disparity?
A health disparity, I would interpret that as being a difference in how healthcare is delivered, or a difference in health outcomes that are due to factors other than someone's state of health, this other than their physical health condition. So if two people of the same physical condition receive different kinds of care for other reasons, because of race or gender or other characteristics not related to their health, that would be a health disparity.
Would you be able to speak on any ways that health disparities are prominent in the La Crosse area?
Sure. One of the numbers that we watch every year, and we've been very involved in the past in reporting on it, making sure that gets out in the news every year, are the county health rankings. And you may have come across that website. So what it does is looks at a variety of health data points, both physical health, mental health, but also health factors. So they look at data related to what contributes to your health. You tend to miss the effects of disparities because our community is so predominantly white. A couple of years ago, I was interviewed by the radio. One of the questions was about where there were disparities, and one of the numbers that I picked on was the the percentage of children living in poverty. And if you looked at the overall number for the county, I believe it was like 11%. And when you looked at children who were white and not Hispanic, it was 10%. But when you looked at children who were Black, it was like 25%. And when you looked at children who were Hispanic, it was over 40%. And so because the actual numbers are small, you lose the percentages. That's a huge percentage, but of a small population. And so the effect gets lost in the averaging. That's worth looking at. That's something that is a disparity.
So, where can people find information on these ongoing projects and how they can potentially get involved?
I know that the creating a healthy multicultural community group has a website, the Waking Up White Collaborative. It's laxwakingupwhite.com, and they have a lot of resources on their page. That's a really great place to start. Hope Restores just started in La Crosse, and that is has a website, and they also accept donations and have some really amazing services, and that they're trying to grow.